Thank you very much for that introduction. And when the organisers asked me to speak, they asked me to give an overview of what the epidemiology told us about alcohol and drug use across different age groups. And I thought, yep, I can do that, and I'll look into it and see what's going on in this space. And, you know, epidemiology of alcohol and drug use across the ages was, to be quite frank, boring. There was really not a lot changing in the last 20 years. But one of the trends I was seeing that, if you'll indulge me, I want to show you some of the patterns we were seeing in the data, were changes that were happening, particularly amongst women and young women. So I'm just going to pose the question, alcohol and drug use across the ages, pretty much the same as it's always been, except perhaps when it comes to women. And then what the consequences of that are. So just to acknowledge my team, Kath Chapman, Tim Slade and Nikki Newton. So the highest rates, and we heard about the brain development this morning, which was just a fantastic introduction to this slide. The highest rates of problems with alcohol and drugs are universally amongst young males, with the highest rates, and then it declines as we get older, with males having higher rates than females. And this is universally shown across the world. So, interestingly though for me, when you look at who's entering treatment, then the group that's entering treatment are more down here. And I'm going to show you some data about that in a minute. So there's a gender gap. So males are twice as likely as females to experience problems with alcohol and other substances. But I started to think, is that changing? And one of the reasons was because of the phenomenal targeting of young women around alcohol and alcohol in particular. So here's some of my favourites in what is not happening in targeting in alcohol at the moment. I don't understand how lip gloss is associated with vodka. That's one of my favourites. But if you buy your $29 bottle of vodka, you can also get this pink Napoleon pre-teenage lip gloss. If you, we heard speaking this morning about the shots, and the shot buckets with the vodka mudslides, where 14-year-olds can't tell the difference between the taste of a vodka mudslide and a chocolate move. So, of course, this isn't targeting women. And, of course, the ubiquitous alcohol and sport. So were there changes going on in the face of this? And the beautiful Catherine Keyes in the US has actually looked at changes in alcohol and drugs and the gender gap over time. She's looked at, this is the prevalence of alcohol use, and she's looked at that for males and females post-World War II and to the present day. And it is actually the case that younger birth cohorts are engaging in more episodic and problem drinking, and this increase is greater for females. So we've got the increase in terms of episodic and problem drinking. That's a pretty big span there, but from post-World War II to the present day. In terms of drugs, there is evidence that drugs are showing a similar pattern. And the ratio in all of the very large national surveys that have been conducted, male and female rates of substance use disorders are converging in 12 out of the 14 countries. And in a big hit for women's liberation, the gender convergence is happening when we've got a mirroring of gender convergence in traditional roles. So in the countries where you've got convergence in drinking, you know, not unexpectedly, you've also got a convergence in traditional roles. What about Australia? The gender gap in Australia is still very clear. Males are twice as likely as females to drink daily, and more than 17% of 14 to 19-year-old females consume alcohol on a weekly basis, and 1 in 10 are using cannabis in the last 12 months in this age group. But is it changing in Australia like it is in the rest of the world? First one I want to look at in terms of whether things are changing is the age of drinking. So age of initiation of alcohol use is about 15.5 in Australia if you're female and about 14.8 if you're male. Okay, so there's still some protective factors there, and there's still, again, showing that males are more likely to start drinking and drinking earlier. But there some good news. There's been a decrease in the age, bad news, been a decrease in the age of initiation of drinking. So if you look at this graph, those people born in 1953 to 1962, no one has to raise their hands. Those people born in 1963 to 72, and our much younger cohorts, those people born in 1983 to 1991. When is their age of initiation of drinking? And this is from a national survey of over 10,000 Australians aged between 18 and 80, asking them when was the first time that you drank alcohol. So if you were 53 to 62, it was just under 16. If you were born in 1983 to 1991, it's 14.5. And remember those development graphs? The difference between 16 and 14-year-olds drinking is considerable in terms of brain development. So when people say, but it was fine when I was in 1953 and 1962, you know, the people that were born in those ages, it's fine, we all drank and we survived. Things have actually changed in terms of first use. But the really interesting thing is when you pull it apart for males and females. So the red line are the females and the blue line are the males. And so if you were born in 1962, you can still remember the fact that when you went into a bar in Tasmania and you tried to get a drink when you were 18, they wouldn't let you in the male bar because you had to go to the female bar. Huge changes. If you're born in 1962, then the age of initiation of alcohol use was about just under 15 if you were males, but it was 17 if you were females. And when we get to these groups who are now born 73, 82, so they're in their 40s now, and 30s now, these groups are convergence, they're start initiating drinking at the same time. This just blows me away. So there's a view that females and males, there's not differences going on, but I think that's one of the biggest trends we're seeing in the epidemiological literature. Do the females, that's okay, that's first use, but do the females have problems faster? So one of the myths around is that females progress faster from substance use to abuse and dependence from the onset of problems, and this concept is called telescoping. So there are keys, again, in the US has really shown that this may not be the case, and in our Australian data, the males had the increased odds of initiating alcohol use compared to females, but once the females started drinking, they didn't have an increased odds of transitioning to a disorder, which is very exciting. That said, when you look at how many Australians and females have an alcohol use disorder, in 1997, in that age range of 20 to 29, there are a lot fewer than in 2007. So between 1997 and 2007, there's an extra 27,000 young females with alcohol abuse in Australia. So if we've got those extra numbers, are they seeking treatment faster? In every area of health, females seek treatment faster and more effectively and more efficiently than men. Men suffer from male bravery disorder. They don't go to the GPs, they don't go to the health professionals. Women, particularly women of childbearing age, they get to the GPs. So on average, Australians generally, because it's dominated by males, don't seek treatment very much for alcohol use disorders. So on average, Australians with alcohol use disorders, they take 18 years after the onset of their symptoms to seek treatment. So this is the lifetime treatment rate. This is 10,000 Australians, and we asked them, this is a group who were alcohol dependent and a group who had alcohol abuse. When was the first time you had your symptoms, and when was the first time you tried to get some help for it? And for alcohol dependence, it was 14 years, and for abuse, it was 23 years. So on average, it makes sense because most people are starting to have the problems that they have in their early 20s, but they don't actually get to help till their early 30s or 40s. Do women seek treatment faster? We can split it by men and women. Well, there were no difference between men and women in terms of how soon after the onset of problems they seek treatment. So there's something really odd going on in this space around drug and alcohol problems in women. There's increasing rates of it, but also there's huge barriers there for them seeking help. So those two probabilities of seeking treatment, they're no different. So do they seek treatment faster? Overall, no. Recent cohorts are getting to treatment faster, but there's females and males, we're not seeing the treatment. So overall, we've got, are we losing our young women to alcohol and drugs? So when I delved into the data, the response was really that rates of substance use, especially alcohol harms, are high and associated harms are substantial. And what was frightening was the change in the gender gap, that the gender gap was actually closing across the general population. And I don't think we're seeing that if you're looking at it from a treatment perspective, because they're not coming to treatment. Young women are engaging in binge drinking and other forms of substance use younger and at higher rates. And as I said, very few of them are reaching treatment, which is a real shame for interventions and staving off the course of long-term disabilities in this group. Now, that said, I then thought, well, that's a bit of a negative way to end the presentation. Is there anything positive? Is there any indications in our literature about some positive things that we could be doing for women and drugs and alcohol? So over the course of the last 10 or so years, we've been doing a lot of work around prevention. Big issue that if we can get in early and give kids some skills and some strategies, then perhaps we don't end up with so many kids with alcohol and drug problems later on in life. It's based on, the work that we've been doing has been based on a universal drug harm prevention program. And I wanted to see if the girls and the boys responded differently. This is really a love story, and it's the best fun I've had doing research. Up here is Michael, Claire and Jane and a bunch of their mates. And this is a cartoon about whether Claire likes Michael, Jane likes Michael. Now, I was one of the people who wrote this, and you'll just notice the colour of my hair. Okay, now you're going to notice the colour of Jane's hair, and you're going to notice the colour of Claire and Michael's hair. Now, in this story, which is embedded in drug and alcohol prevention, Claire likes Michael and Jane likes Michael. And at the end of the story, to keep the kids engaged, it's effectively a love story about whether Michael chooses Claire or Jane. Which one does he choose? Claire or Jane? Sorry for all the blonde women in the audience. That's right, Claire. It's my revenge on 20 years of high school and university and missing out on the blonde boy because of the blonde girl. Sorry, all the blonde girls in the audience. But all jokes aside, it is really truly based around a story like Neighbours. And based into it, it goes into schools, it's interactive, it's a cartoon, there's curriculum-based activities. We've done research now on 14,000 students in 157 schools across Australia, and there's an additional 194 schools and 15,000 kids using this program right now. And I'm getting a school, it's available free over the internet, and I'm getting 3 schools a week. There's a UK site, a US site, Canada and Ontario just talking to me yesterday about implementing it across their curriculum, because they are now understanding that within education you need to respond and implement health interventions. And they've come to us from the evidence. It's registered on the National Register for Evidence-Based Prevention Programs in the US. So, does it work for boys and girls? So as I said, it's computer-based, it's over the internet, and we do normative use, short and long-term risks, influence of the media, refusal, and staying safe. And I think the biggest effective aspect of this, 2 things, it's peer-led. There are no adults, and because the minute you get an adult telling the kids what to do, they're like, forget it. We have no credibility whatsoever after the age of 18 when you're doing drug and alcohol education in schools. And the other effective thing is that if you ask 13-year-olds in Australia how many of their mates are drinking, they'll tell you something heavily, 68% are, when in actual fact it's more like 5%. So really creating that dissonance in their mind has been incredibly powerful. Just to give you a little idea, there's hundreds of cartoons. The other side issue is, luckily, Laura Vogel, who was my PhD student, her best mate was one of the cartoonists for Happy Feet, and so we got him to do the cartoons. So we didn't muck around with you've got to have quality products for kids. Every time she drinks, it ends in tears. I'm getting sick of this. I just want to die. Teenagers. Do you want to go home? No, I feel too sick. Ugh, she vomits all over Michael. That's why Claire doesn't end up, that's why Claire gets him. Jane vomited all over him. We spent a lot of time at the end, just think about this, we spent a lot of time trying to work out what are the negative consequences of alcohol and cannabis use for young males. So particularly the men in the audience, you sit there and think, what were the negative consequences of alcohol use for you when you were 13 or 14 or 15? And then at the end, I'll tell you what we found with the boys. It's to do with vomiting. This is just one of the trials that we've run. Year 8 students, cluster randomised control trial, lots of kids, pre-post, 6 months and 12-month follow-up. And I've just split the data because I was curious by males and females. So this is average alcohol consumption, males and females. And actually for males, we didn't do so good. But for females, we did get significant differences. And both groups ended up in the low-risk adult group. So remember, this is prevention. So what we're trying to do is stave off this increase in the proportion who are average consumption across increasing their average consumption. So these are kids who are going from 13 or 14 through to 15 or 16. So at this point, they are all starting to have their first experiences with alcohol. So we're just trying to arrest it a little bit. In terms of binge drinking, again, the boys in both the intervention and the control group basically mirrored each other. But actually for the females in this trial, we did really quite well. We managed, not perfectly, but somewhat, to arrest it, at least till they get to be 14 and 15. In terms of alcohol-related harms, no significant differences for the males, but same pattern. We've got very low, they're very low rates. Remember, these are 13-year-old Australian high school kids in schools. Very low rates, but significant differences. So, my question was, are we losing them? Well, I think things are changing, and I do think we need to focus on women before we end up with potentially with a group who have problems and who are not seeking treatment. And I do think that some of our prevention programs have the potential to delay the onset and reduce harm, especially for females. Now, you had a chance to think, I've got a minute, I think, what is the negative consequence for drinking if you're a boy? Anyone got any ideas? Go on. Getting caught? No, they weren't worried about getting caught. Getting into a fight? No, that was in Australia. You'll win awards if you get into a fight if you're 13. Good try, Igor, but not in Australia. Sorry?
18 years of symptoms as parents, as partners.
Yep, nope, not for a 13-year-old. But I wish they did understand that, but no, not as a 13-year-old. You ready? Throwing up in an attractive older female's lap. I am not kidding. So we change. That will do it. Every boy in the audience is going, yeah. So that is an incredibly powerful message. It took us a lot of focus groups to extract that out of the boys. But a very, very powerful message. So getting the message to them and, again, getting the message around the making sure our message around alcohol is embedded in what makes sense to them culturally and socially. So anyone want any further information, you can find the cartoons and you can register and get access to them if you're interested to them on the Climate Schools website. And other information around this work and this webinar series is available on our CRE website, www.comorbidity.com.au. Thank you very much.
Thank you so much for a wonderful presentation. Very thought-provoking, and that gender convergence is definitely something, as a director of a service, I think that we should be spending more time thinking about why aren't the females coming along. So do people have any questions?
I have one question.
Come on, Brett.
My question is, what do you make of the gender difference in regards to prevention of the alcohol problem in the boys and girls? That spike in the boys, I mean, they ended up higher than baseline after the intervention.
Yeah, and look, we're struggling with different ways of trying to engage the boys. I mean, I don't think it was just because I was a girl and we wrote the cartoons and that with other female PhD students, but I do think 13-year-old girls are just a heck of a lot more verbal. And what I'm doing there is like a love story, a cartoon. The boys want to know, if you talk to the boys' schools, they do want to know how to meet girls, and so you can get them engaged, but they don't read. So 13. So we've been playing around with the idea of a game, and whether through a game we can get them engaged and then get them to do the work. So there's a game on our website called Pure Rush, which is like, yeah. So I think the other important thing is that we haven't been able to, we've shown it a little bit. The females got that there was when we ran this trial, there was a difference between safe drinking levels for males and females at NH and MRC. So the females had it in their heads that they could keep up with the boys. But when we created that dissonance, they were like, oh, there are actually physiological reasons why the same amount of alcohol I'm drinking and my mate Tom's drinking, they'll have different effects. And I think that was incredibly powerful with the girls, but I didn't have a corollary for the boys. So, yeah. Yeah.
When you were doing this at the pre and
So, yeah, but we've got, like, there shouldn't really be any difference between the control group and the intervention group. So, yeah, maybe boys are not telling us, but the difference shouldn't be any different in the control group. That's why we've sort of randomly allocated the schools. But yeah, self-report, I'm always thinking, oh, can I rely on the self-report? So we've got embedded lots of strategies, like the surveys are done online, they're done independently from the school, they're emphasised continuously, how consistent and how secure they are. And when you look at that data, it's very similar to every other self-report. So I don't see any trends that indicate that it'd be wrong.
How culturally appropriate is the week of Adventure influence? I don't know, communities or young people that have impact.
How appropriate? You know, I've now, I would really like someone to sort of see this, have the knowledge from a group such as, where did you say you were from? North Queensland, yep. A lot of people say to me at conferences, this is storytelling, and that would be so appropriate for, and it doesn't have to be verbal. I've got very little words here. I could have no words, but it's storytelling, and it would make sense for different, particularly for Aboriginal and Torres Strait Islander and Indigenous Australians. But I have not, I've tried 3 or 4 times, but we just haven't quite worked out which group haven't quite made it work. So at me standing up here as a white female, arrogantly, I'd say to you, I'm just so passionate about this story, and if anything I learnt from the kids and from other cultures, that story was so important. So I think it's great, but that's me as a arrogant white Australian researcher. So if anyone wants to collaborate with me, please come and talk to me. Oh, yeah. You have to be brave in this country if you've got depression to seek treatment. You have to be a complete martyr in this country if you've got an alcohol use disorder to seek treatment. I think the cultural is really, really significant cultural and stigma barriers, and that's another talk I'd be happy to. But you hit the nail on the head. Yep. Kate, who is expert on Indigenous and go for it. Yeah. So I think it's Principles Australia Institute have very, very strong links with myself and with schools, particularly in remote areas, and they were keen. We just not cracked it.
Well, please join me in thanking Professor Maree Teesson.